Exercise does little to tackle obesity, according to a group of doctors and sports scientists. Writing in the British Journal of Sports Medicine, 3 international experts say it's time to bust the myth that you can eat what you want as long as you're active. They accuse the food industry of misleading the public and of sabotaging public health campaigns. Our health correspondent Adam Brimelow reports.
There's no dispute that exercise is good for you, improving health and reducing the risk of an early death. But there is an argument about its role specifically in weight loss. NHS advice to treat obesity includes activities such as walking or jogging alongside what it calls a balanced diet. But that's being challenged. The editorial attacks the food industry, accusing it of manipulative marketing by associating what it calls junk food brands with sport. The authors say that's misleading and unscientific, designed to promote profits but harmful to public health. They say it suggests people can eat what they like as long as they exercise.
My biggest concern is actually the public health messaging that has been corrupted by vested interests. In particular, the food industry have used this as part of their public relations or PR strategy to deflect away from their own irresponsibility in the obesity epidemic.
The Food and Drink Federation says the article appears to go against evidence-based public health advice. It says companies are promoting physical activity, but they recognise their key role is to help people to a balanced diet by clear labelling and offering products with less salt, sugar and fat. A senior spokesman for NICE, which has produced guidance on obesity for the NHS, said it would be idiotic to rule out physical activity as part of the solution. Adam Brimelow, BBC News.
Well, we can talk now to Dr. Aseem Malhotra, who you just saw in that report. He's with me now. He's the co-author of the editorial and also an interventional cardiologist at the Academy of Medical Royal Colleges. Thanks for coming in.
Hi there.
So just explain really clearly then, what's the balance?
Well, the first thing to say is there's no doubt that exercise has many benefits for health. You know, regular activity reduces the risks of heart disease, type 2 diabetes, even cancer and dementia. There's no doubt about that. But weight loss is not one of them. And despite this very clear evidence, the perception amongst the public is that actually exercise may be the cure for obesity. That's actually wrong. It's the amount and the type of calories we're consuming that's key. And the evidence is now telling us that sugar and refined carbohydrates in particular are driving that. One of the other messages that the food...
Just to go back to that though, I mean there's a direct correlation, isn't there, between how many calories you need to intake and how much physical activity you're doing, how many calories you're actually using. So therefore it makes sense, doesn't it, to think if you are increasing your calories, you can do exercise to counterbalance.
Yeah, well, that's actually slightly an unhelpful message. I mean, that's what message that people get, but actually the body doesn't behave in the same way depending on what calories they consume. So, for example, we know sugar and carbohydrates promote fat storage and hunger by their effects on insulin, whereas fat produces fullness or satiation, if you like. But actually, the way the body reacts to different calories also influences appetite. So we know that, for example, sugar calories increase people's appetite. So to talk about the calorie theory around exercise, many studies have shown, for example, that actually people end up consuming the same amount or even more calories than they've burned, because exercise is actually quite a powerful appetite stimulant. But if you look at the data over a long period of time in terms of exercise levels, average exercise levels over the last 30 years, for example, in America, levels haven't changed. It doesn't mean we shouldn't do activity, but they haven't changed very much, whereas obesity has rocketed. And that's being driven primarily from consumption of junk food and processed food. So
you're saying the only way to lose weight is actually to cut your calories?
Absolutely. So, you know, everyone should do a little bit of activity. You know, if I didn't believe that was true, I wouldn't be, you know, spending 20 to 30 minutes in the gym myself every day. But actually, if you're going to control your weight and improve your metabolic health, it's through reduction in junk food, particularly added sugar, refined carbohydrates.
Thank you very much for coming in, Dr. Aseem Malhotra.
Thank you.